Welcome. It's really great to see so many of you here today. This is the first in our maternity series, Delivering Change, Innovating, Improving and Transforming Maternity Services. I'm Alex. I'm Q's Head of Operations, and I'm really pleased to be able to chair this series. Before I introduce our speaker today, Martin Hogan, who'll be starting off this series for us, I'm just going to provide a little bit of digital housekeeping. For those of you who are not yet part of our Q community and do reside in the UK and Ireland, we would love you to join us. We have over 6,000 members across the UK and Ireland who all are collaborating to improve the safety and quality of health and care here. Hopefully someone will be able to move the slide deck on one, which will share a QR code. There we go, for you if you are inclined towards using QR codes. You can use that to find more information about how you can join us. As we go through the workshop today, please use the chat to ask any questions, either to our speakers or to our team. You can also use that if you're having any technical issues or have any questions about what's going on, or just to say hi or goodbye. There are closed captions available for this session. If you would like them displayed, to access them, you need to click on the bottom of the screen under More, where you'll see that CC code available. Shah is here to support us on technology. So if you have any technical issues, pop them in there and she will do her best to help you. We're going to be recording the workshop today. We won't record any of the breakout rooms or discussions, but we will record the presentation and questions so that we can share those again afterwards for people who have to leave early or haven't been able to make it today. As I've highlighted, there will be a post-workshop email, so look out for that, and we will share our slide deck as well. I am otherwise going to move to hand over to Martin. So I am really delighted to introduce Martin. He is a Q member, and he is a director of the Improvement Coalition, which is a non-profit consultancy, which he co-founded and is one of the first LGBTQIA Irish-owned consultancy companies. He has over 20 years experience as a nurse within the NHS with a variety of clinical roles, including working as a Macmillan acute oncology nurse specialist. Martin is a qualified QI coach and executive coach and innovates multiple QI projects supporting healthcare staff across systems. And with that, I am going to hand over to you, Martin.
Thank you, Alex. Well, don't I sound impressive? Gosh, that's really weird to hear your biography back to you. But thank you very much for that warm introduction. Like I said, like Alex said, I'm Martin, and today we're going to have the best webinar you've ever been to in your life, because it's fun and exciting. And the structured approach, we might run over or quicker, but our structured approach here in our agenda is I'm going to share my QI journey with you of what I've done with the Q community, which has been life-changing, honestly, and hopefully inspiring you all to then think about representing maternity in specialist interest groups. And then I'm going to share some quality improvement projects that I've implemented and have been so successful. I am hounded by midwives from all over the country wanting to borrow the brilliance, which is very, very exciting. But so you don't have to listen to me talk at you for an hour, we're going to get you into breakout rooms then as well, so you can network with each other, because that's really powerful, networking with one another and sharing your practice and having a think about, you know, problems and things in your area that you might want to borrow some of the brilliance that you hear today and share and connect with other people in maternity services as well. So I'm very excited about introducing you to our webinar here. So one QI project born every minute. I thought you'd appreciate the title, From a Nurse to Maternity Services. And I'm Martin Hogan. And as we've said there, I've been a nurse for 22 years. Well, let's say 22 plus years. I can't fake being under 40. I've had a rather dramatic career, thinking that I had to work in all those really scary places like A&E and ITU, and realizing actually I hated them and I didn't like working in those environments. But then 4 years ago, I trained to become a professional nurse advocate, and you'll know PMA, professional midwifery advocate. And in the last 4 years, my life has kind of changed, and my brain has definitely got quite big in comparison to where it was before. I didn't know what quality improvement was. I had no insight into it, but my boss kept saying, you need to start doing QI. So forced me on to do QI courses. And then I was bitten by the bug. So I became bitten by the quality improvement bug. And I thought, wow, this is really impressive. And as someone who's dyslexic, my brain is often chaotic, but I find utilizing quality improvement methodologies helps me just stay on track. So it actually improves my practice. And I have done some amazing things to support staff across multiple systems. And we'll look at those a little bit later. I think I've supported well over 1,000 staff with delivering quality improvement or restorative clinical supervision. I've done lots of things. I've maybe got a big mouth, too big of a mouth, because I brag about my brilliance and my success. And then people like NHS England go, well, Martin, if you're doing that locally, why don't you do it regionally? And then people further go on to say, why don't you do that nationally? So I've actually done the 2 QI projects we're going to look at. I've done them regionally and nationally. And little old me, who didn't know anything about QI, would look back and laugh now that I've gone on to do these things. So it's helped improve my development in leadership and quality improvement. And then I joined the wonderful Q community as a member 2 years ago. And goodness me, have I done things I didn't think I'd possible. And I would highly recommend becoming a Q member because there's so much option for development. There's support, there's things that you wouldn't expect, like how to be better at AV, audio visual, and you can do podcasting and all kind of things like that. So the networking is very powerful. And I've been supported greatly and mentored by people in the Q community. So that's kind of my salesman's pitch for becoming a Q member. We're going to have a bit of fun. So nothing about me is formal, and I don't want anyone to be formal in this space. It's all about fun and joy. But as I said, I retrained as a professional nurse advocate, and I joined the Q community, and I thought, oh, there isn't really, we're supposed to be doing lots of QI as PNAs and PMAs, but no, there's no one really in this space. And I thought, well, actually, if there's nothing here, I have the responsibility of kind of being the first to invent that. So I invented, with the support of Q, I wouldn't have been able to do it without them. I had all these ideas and I went to Q and I said, would it be possible to form some sort of like network that would be on the website and we could have a page dedicated for all things professional nurse or professional midwife advocacy? So they said, yes, Martin, there's something called a specialist interest group. Here's how you do it. And I thought, oh, brilliant. So I set up a specialist interest group. For those of you that don't know, just a bit of the background of the PNAs, PMAs. This is post-COVID NHS England's response to fund nurses and midwives to undertake their professional advocacy course, which is a course that trains us in supporting staff. And how we do that is by delivering restorative clinical supervision, which is the cousin of clinical supervision, career conversations and QI, but it doesn't really set us up for success with QI. So lots of people know about it, but don't do anything with it because they haven't been told they have to. So this support is for organisations, and it helps improve retention as well. So this was massive. And I think there are 6,000 professional advocates within the UK. It's going into Wales and Scotland and Ireland. So it's not going anywhere anytime soon. And if you are a nurse or a midwife and you are not a PNA, PMA, I would highly also, another salesman's pitch, I would highly suggest talking to NHS England to look at going on the course because it's changed my life. But really, I couldn't see anything on the Q community. As a member, I thought it was my responsibility to set up the specialist interest group, and was supported by Q. I promoted and recruited members, grew interest, and then we had actual events. So here's what it looks like on the Q community website, professional advocacy there. So you can see we've got 70 members, which is amazing because it started off for months with 0, and then it kept growing and growing and growing. But the headlines really to share some learning. We ran events, so we had a monthly event in 8 in total, which provided PNAs and PMAs with a networking space. We played QI games, we brought the community together, We were upskilling people through fun. We had guest speakers, and yes, it kind of felt to me a little bit like a WI meeting. We didn't make jam, but we had fun and played games. We didn't sing songs actually, so maybe not. But it was so successful that we had over 1,500 attendees in total, and the feedback was ridiculously impressive. So you can see here that the evaluation at these events, people saying that these events consistently re-energize me in my role. The opportunity to network and discuss QI approaches during RCS sessions has increased my confidence in practice. And Martin's facilitation style is both engaging, informative, and makes the sessions feel inclusive and valuable. And I thought that really touched me, but also helped improve my development, because I don't know about anyone else, but I like public speaking, but it is nerve-wracking, isn't it? So getting feedback as the leader of the group was really important for me to understand if it was doing anything and if it was worthwhile. So that kind of demonstrated that having that psychologically safe space to network with other people in your speciality is so important. And I would really encourage a maternity specialist interest group. I think that would be phenomenal, and happy to share any learning with anyone who leaves this meeting inspired by all the wonderful things that I've managed to do with Q. And this was the main feedback. So my personal learning and reflection is a central insight from this project for me is having this transformative experience attendees had when provided with a psychologically safe space to share practice, network and learn. The attendees not only grew individual capability to deliver QI, but also now they contribute that learning to the wider systems for improvement, which is amazing. And we had representation from people from Wales, Scotland, Ireland, England. So that little space grew many legs and flew off into a butterfly of improvement and development. So highly recommend specialist interest groups. But because, as I said, I maybe brag about my success too much, I was upsetting people who weren't PNAs and PMAs. So lots of nurses and midwives came to me and said, Martin, that's great. That's wonderful. You've got that success for those 6,000 people. But what about the 880 NMC registrants that they've got? What are you going to do about us? So I thought, okay, in QI, for those of you that know, there's something called the Pareto principle. So Alfredo Pareto was this polymathematician, and he loved P's, and he did the 80-20 rule. So I was thinking, in style of Pareto, we're going to have the pod of nurses and midwives. So all things, that's an inside QI joke for you there. But also thinking about a pod of protection, I think about Wales and how they all look after each other. And the learning that I took from the professional advocacy group was that the feedback was, as you can see, the feedback was so powerful about the ability to network with others. So I thought we are now a pod of nurses and midwives. And you can see here that we don't have as many members yet. So if you are a nurse or a midwife and you'd like to become a member of the pod, please do feel free to email and become a Q member. We also have a Facebook group, because I realise that nurses and midwives are often on Facebook. So if you want to join that here, it's interlinked to this group as well. And we're trying to get people in to be members of the Q community. We've had one meeting and we only had 5 people attend. So I can't brag yet as much as I can with the other one. But you can tell I'm not the sort of personality to give up. So we will make this even more successful than the professional advocacy group. It's just at the infancy stage, of its development. So I'd highly recommend coming to these. But also you might think, well, I don't feel represented. And then I'm sharing the learning of you could be the change you want to see. So you could set up your specialist interest group and run things like that. It's been such a pleasure and such an honor to do. And I've done things and met people and had experiences and improved my knowledge and practice of quality improvement. So I'd highly recommend that. I put this here to remind myself at what point we are. So now I'm going to share something that midwives love this. So they love my radical, playful ideas. So I often think about retention and how terrible it is, and how the focus often in systems is on recruitment. And I keep saying to people, no, it should be retention, retention, retention. Forget the recruitment. So I was walking past this director of HR, and she looked very stressed. And I said, "How are you?" And she said, "Oh, I've just had a day, Martin. I've just had a day of itchy feet conversations." And I went, "What is that's a delicious term. What's an itchy feet conversation?" And she said, when people want to leave or they want to run away from the trust or the organization, they come and complain to the director of HR, and I see what I can do to try and improve them or get them to stay. And I thought, no, 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 I'm not going to be outdone by HR. The professional advocates in my NHS organisation, in the community, in the capital, we are going to invent a quality improvement project called Itchy Feet Clinics. So these clinics I put on, and I did a lovely poster which we'll look at. I did get in trouble though with the podiatrists in the trust because they thought that I was coming for their business and trying to take patients away from them. I said, no, 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 no. It's metaphorical. I'm not actually running itchy feet clinics for patients. These are itchy feet clinics that are going to be a QI project to help improve retention. So why did I do this? So that's kind of what I looked at the staff. They looked like they were all screaming. And there was quite a damning CQC report of a particular division. And the director came up to me looking like that, saying, Martin, what can you do? What can you do as a professional advocate, as a lead nurse, to support this division that has terribly high turnover, poor recruitment and retention, and a low morale? And I said, well, it's funny you said that because I've just left the director of HR and she's got, so I came up with Itchy Feet Clinics. And what they were is I utilised quality improvement to help improve retention in this area with low and poor morale. I tried and tested my idea. People loved the thought of it, an Itchy Feet Clinic. That sounds exciting. So I provided regular space to run the Itchy Feet clinics, and I did them informally. I kind of just made it up. I used quality improvement methodology. I did a proper project, but I really did kind of just make it up, given that there was a need for this support. And I did a couple of them as a trial and a test, and the feedback was so positive, I couldn't fit my head through the door by the time I left. I thought, wow, I am really amazing at this. I must be really good at quality improvement and supporting people. So here was our PR poster. You can tell I like colourful, radical things. So we'll look at the teeny tiny print in the next slide because even I can't see what that says at the bottom. And that's the most important bit of the whole thing. So Itchy Feet Clinics are psychologically safe spaces for staff who are overloaded to talk about how they're feeling, why they're feeling. They might feel like running away, so they're itchy to run away, or they're itchy for further development, or they're just feeling itchy and they're not sure what is making them feel itchy. So I get them in a space, in a group or one-to-one, and I put on this informal, protected time where we talk through what's making them feel itchy and why. So I utilise my clinical supervision skills and my quality improvement skills. And you can see, well, I can't see, but we'll look at the next slide. So if you don't believe that these were successful, this is what I bragged to my chief nurse and the director of HR. I said that 99.9, which I was annoyed it wasn't 100%, but 99.9% of staff who've attended report feeling better and less stressed. 100% of staff leave feeling clearer with the next steps. 145 members of staff have gone on to undertake the P&A role because they think, wow, if Martin can do it, I can, and I can go off and look after people. 25 staff have got a promotion within the organisation. Now, I don't brag to senior people about this bit, but 3 staff actually went off sick because it was the first time in years that someone had held a mirror up and said, I think you're actually unwell with work-related stress and shouldn't be at work. I don't think you're safe enough to be at work. So I did encourage 3 people to go off sick. They then came back, different people, and I actually got a box of chocolates from a couple of their husbands. So I clearly did something right by making sure that they were getting the proper care that they needed. So QI is not just for Christmas, it's for life. It's embedded in our practice. It's there to help improve retention. And that's how I did it. So if you want to transfer this into maternity services, please feel free. We call it borrowing the brilliance or pinching with pride. So you can see that bragging posters of mine, it was brilliant. It did work. So here's how I did that. Where I started, setting ground rules for psychological safety, using all of my P&A skills, check-in tools, setting the mood. And what would I say? Simply, how are you? How are you feeling? What's going on for you? Why are you feeling like you want to run away? And then if things escalate, I had little kind of governance thing of if I needed to escalate to the director of HR, freedom to speak up, or a HRBP, I would do that and that would come through me, and then I could escalate anything that needs escalating. I can't remember, I don't think anything needed escalating. Everything was sorted in that space quite quickly, which is great. Another one, which again, my learning is Martin, stop bragging to people, particularly NHS England, because they'll make you do more work. Another project, which you also might want to borrow the brilliance, was something called Teaching Tuesdays. So I supported 4 different sessions of how to do clinical supervision, how to do career conversations, how to do quality improvement and innovation, and how to implement the P&A, PMA role in people's organisations. So I ran these regionally and then evaluated, and you'll see the colourful evaluation, but they were very, very successful. And this went on to be a regional event, and then a national event. And we'll talk about why I put Tom Jones on that in a little bit. But basically how I did this was I looked at the fact that professional midwife advocates and professional nurse advocates didn't feel very confident often at delivering quality improvement or delivering restorative clinical supervision. So I set these teaching sessions up. My measures for success were how many people attended and the pre and post evaluation. I implemented them. It was so successful that people called me up and said, right, you need to make this a national project, and I expect this done by April 2024. So in 2024, I was very busy doing lots of teaching. And in quality improvement, as you'll all know, there's something called the 7 whys or the 5 whys. And when that's to understand the cause and effect of a problem. But as I said, I'm a bit childish. So when I think of the 5 or the 7 whys, all I can hear is Tom Jones going, why, Delilah? So every time we think about understanding the cause and effect of a problem, Tom Jones appears in my head. So Tom Jones is now very embedded in quality improvement to me. So you can see here, I don't even have to brag, the slide does it for me, but the pre-attendance and the post-attendance feedback. So the blue is the pre, the green is the post. So you can see massive success in people's growing their confidence. So how confident they felt in delivering clinical supervision before in the blue, and how confident they felt afterwards. So how confident again with career conversations, and then how much more confident after. The one that I really loved was how confident then people left the quality improvement one, because I knew that was probably the area of weakness because it's not kind of embedded in all of our systems yet. So that I was really proud of that. And most importantly, the qualitative feedback there is people felt it was their happy place and they needed it. It was an excellent learning space. They loved the sessions. They can't wait for what's next. So that's really powerful. So quality improvement, I think, is how we better look after one another and therefore better look after our patients. So sharing is caring, and this quality improvement project really did just that. So some further feedback there as well is people felt it was really helpful. And I think that's my learning. If I've learned anything, and I feel like I've learned quite a lot, but that learning really is that, you know, if you can't see it, you can invent it yourself and make it a quality improvement project so you can measure your success. And you can see through these projects that had I not have made it a quality improvement project and it was a just do project, it would have been a bit chaotic. So I needed quality improvement to ensure that I was staying on a good line. So between the professional advocacy specialist interest group grew that massive community of practice to look after one another and develop people and upskill them in quality improvement. The second project with Itchy Feet clinics, improving retention in people's roles, that was really successful. And again, something that you can borrow and implement in maternity services. People really like it. Like loads of midwives really like the idea. And then Teaching Tuesday clinics. I mean, you might want to do a different day. It doesn't have to necessarily be Tuesday, but it's the kind of bite-sized learning. So having bite-sized learning was really successful and people really liked it. And it was short, sharp, and to the point. And you can see, I mean, I'm not making any of this up. People really did feel that this was improving their understanding and their development. So again, something maybe in maternity services that you might want to implement might be bite-sized learning. If I can do it, anybody can do it. That's my kind of key theme of the session, really, is to demonstrate that I knew nothing about quality improvement, and now I'm doing all these wonderful things and improving people's confidence. And my kind of love language, I think, is service to others. I love developing people, but I also need development as well. And that's why I was bragging about the Q community, because I've got so much development from the Q community. Honestly, I can barely turn a laptop on before I joined the Q community. And now I'm looking at doing podcasts and lots of different videos. So there's a specialist interest group for everything. Anything you can think of, there's there. But maybe there's one specifically that someone in this room from maternity wants to implement. And I'd highly recommend people to do that too. So I think that's enough of talking at me. And we'd take some questions or reflections before we go into the breakout rooms. Anything that anyone wants to ask me. I can't see anyone's hand go up. Yes, David.
Hi there. I'm working on something similar for bite-sized learning, and I just
Yeah.
wondered if you had a definition of what counted as bite-sized learning, because we've quickly found bite-size can turn into 15, 20, 30 minutes and get longer very quickly. So we're looking at defining what we include in our bite-sized learning program, but working
Yeah.
on what we're going to define and include.
Yeah, thank you for being the first to ask a question, David. Much appreciated. I would say anything under 45 minutes can be cut because that's a good amount of time. Plus, you can actually get a lot of information in that time. An hour was too long. So my learning was don't do an hour because you will be exhausted talking at people for an hour. So anything under 45 minutes, I think, is good amount of time for bite-sized learning.
Excellent. Thank you very much.
Thank you. Any other questions or reflections?
I think we've just had one in the sidebar from Claire, actually, Martin.
Oh, lovely. I can't see the sidebar for some reason.
So Claire's just asking, I hope that's okay, Claire, if I just jump in and say your question. She's wondering what your principles are for making spaces psychologically safe.
Yeah, do you know what? It's as simple as creating what I call contracting. So if you and I, Claire, were in a meeting by ourselves, I would literally ask you what makes you feel psychologically safe in a space, and then I would share with you what makes me feel psychologically safe in a space. So mine are always that it's confidential unless I'm at risk of harm to myself or others, and the same for you. That it's anti-hierarchical. So you might be a fancy schmancy chief of something, but it doesn't matter that I'm a band-aid and you're more, you get paid more. So it's anti-hierarchical, it's anti-discriminatory, and if at any point either one of us feel that that has been broken, we will go back and review the psychological safe contract and look at what we need to do for next steps.
Joining us, I hope you found some of Martin's humbleness and I guess I do actually, I really admire and I love how much pride you have in your work, and also what a great advocate you are for QI and for the Q community. As Martin has mentioned, we have a number of SIGs that may be relevant to you. There are also there's a wide range of special interest groups that we host in the Q community. Martin's presentations were full of a lot of joy, and I will just give a little shout out to the Joy in Work SIG, which is one of the ones that I'm involved with as well. But we look at a lot of different aspects of the working life of the healthcare professional. So do get involved if you are not already.